Hello everyone, my name is Siska Christin. I'm an undergraduate student at University of Jember pursuing a bachelor's degree in nursing. At this time, I had the opportunity to explain about an important health problem that is experienced by people in the world, called cancer. Okay, there are several subtopics in this video, including definition, statistical data, causes, signs and symptoms, stage, prevention and management of breast cancer. Before that, I'll ask you first, have you heard about cancer? Okay. Cancer is a disease that occurs when some cells of the body grow uncontrollably and spread to the other part of the body. Cancer can start almost anywhere in human body, such as lungs, liver, brain, breast, and others. But in this video, I'll focus on breast cancer. Based on Global 2020 data, the number of new cases of breast cancer reached more than 2.2 million, or about 11% of all cancer patients in the world. In 2020, 680,000 people died from breast cancer. Breast cancer ranked first in terms of new cases of cancer and ranked fourth as the leading cause of death in the world. So what is breast cancer? Breast cancer occurs when healthy breast cells become abnormal, grow out of control and form tumor, a malignant tumor. It can start in one or both breasts. Breast cancer can sometimes spread to the other part of the body like arm. What about the cause? Causes of breast cancer is multifactorial. It is divided into non-modifiable factors such as female gender, older age, family or self-history of cancer, density of breast tissue, genetic mutation, pregnancy, breastfeeding, menstrual period, and menopause. And the second one is modifiable factors such as physical activity, overweight or obesity, smoking and alcohol use, intake of processed food, insufficient vitamin supplementation, and exposure to chemical and drugs. Okay, now we'll talk about cancer prevention. Cancer prevention can be done by maintaining a lifestyle, carrying out screening tests such as having a healthcare provider examination, having X-ray of the breast called screening mammogram, and having breast self-examination. We can check our own breast about the same time at each month. And how to do a breast self-examination? Step 1. Stand in front of a mirror and check your breast for the changes. Signs of breast cancer can include change in breast shape or size, a lump or thickening in the breast or armpit, swelling, warmth, redness or darkening of the breast, dimpling or puckering of the breast skin, and itchy, scaly sore or rash on the nipple, pulling in of nipple, and pain in one part of the breast. After that, raise your hand and look under your breast for the same changes. Also feel for a lump or hardness in this area. Check the nipple for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even blood, and it should be checked immediately. Second step, stand in front of the mirror and using slow circular motion to feel your breast for any kind of changes. Follow a pattern to be sure to cover the whole breast. We can begin at the nipple and moving in larger and larger circle until we reach outer edges of the breast. Check the inner part of armpit as well. Always use opposite hand to check the breast like this or like this. Then the last step, lay down in a firm surface on your back and repeat the same circular motion from step 2 across each breast. If you detect anything suspicious in either of these steps, don't panic. and make a note of your finding and schedule an appointment with doctor immediately. In general, there are 5 stages of cancer that is determined by the size and location of the cancer and whether it has spread to the other part of body. It is O, 1, 2, 3, 4, which O, cancer has not spread to adjoining tissue, and 4, cancer spread to distant lymph nodes and affect organ. Breast cancer is also graded into A, B, C, with A being the most similar to normal healthy cells and C being the most different from normal cells and the most aggressive. Moving to breast cancer management. It depends on type and stage of the cancer. The treatment, including initial surgery, neoadjuvant or adjuvant chemotherapy, surgical management with or without radiotherapy, hormone therapy, targeted therapy, and combination therapy. And besides that management, people with terminal cancer are also familiar with palliative care. Palliative care is an approach that improves the quality of life of patients and their family facing the problem associated with a life-threatening illness and problem related. One method that can be done for end-stage cancer, such as SAF or Spiritual Emotional Freedom Technique. Through 3 steps, the setup, tune in, and the tapping. We come to the end of this video. I'd like to conclude this explanation by breast cancer is the most common cancer in the world. Cancer management is done through pharmacological and non-pharmacological measures. On the other hand, prevention of this cancer can be done by maintaining a lifestyle, carrying out diagnostic tests, doing breast self-examination, and before breast cancer occurs, it's better to do prevention. And please remember this, it's not only the competition that deserve an award, but also your bravery in fighting cancer. Thank you for your attention. I apologize if there are mistakes in my words and deeds. I wish this information is helpful. Goodbye. Have a nice day. Bye-bye.